Hi, and here we are with the Heart and Bones podcast, and we are talking to the wonderful Dr. Angela Holliday-Bell, who is a sleep specialist, MD, author of the book Sleeping on the Job, and really, I think, just a passionate sleep expert that I'm really excited to hear all about how you work with folks, how sleep is important, and again, from that MD perspective of like, okay, let's talk about sleep and health. So, welcome, Angela.
Thank you. Thank you so much for having me. Always excited and ready to talk about sleep. Of course, it's literally my favorite subject.
Well, I think I love that. And because especially when you're, I'm assuming, never having gone through medical school myself, but when you're going through medical school, there's so many different specialties and so many different ways that you can work with people. So, what was
Mhm.
it about sleep that you were just like, sleep, sleep, this is what I want to do? Tell me
Yeah.
why and tell us all why we need to sleep.
Yeah. No, it's a little bit of an interesting journey and pathway to sleep for me. I am actually a pediatrician by training. So I decided I was going to be a baby doctor when I was 6. That was always my journey. But what I didn't realize is that during medical school and particularly residency, you do not get a lot of sleep. And I'm someone who's always needed a lot of sleep. Like sleep has always been my thing. But going through training, I started to suffer from insomnia. And it actually was the most frustrating experience I've ever had in my life. And so my journey through sleep started with just my own quest to fix my sleep. I was like, this is not gonna work. I'm actually a much worse version of myself because I'm not getting sleep. So I started to research everything there was about sleep. I read every book there was that I knew of, at least on sleep. I started to volunteer in the sleep clinic in my hospital. And in that process, fell in love with sleep. And I was like, oh, this is more important than just like feeling rested. It actually is critical and vital to every facet of your functioning. And so I started to put into place the things that I was learning. And in the interim, started to help patients who were struggling with sleep issues and friends and family. And so I knew there was something more there, and it was something I was so passionate about and really felt like other people needed to know about. So after residency, I actually became certified as a clinical sleep specialist, became certified in cognitive behavioral therapy for insomnia, started my business, The Solution is Sleep, and the rest is history from there.
Wow. And isn't that ironic? And that like during your residency where you're learning to be a doctor, to heal people, that the very structure of it is so harsh on the residents and as you're learning and doctors themselves, depending on what type of practice they are in afterwards. And that's just in itself kind of interesting and systemic and maybe a different conversation.
I always tell people the
But
worst thing you can do for your sleep is go through residency. It's like actually the absolute worst thing you can do. But it sparked this passion and I'm able to help other people. So, I'm grateful.
yeah. Yeah, I love that. And so now working with people, because my understanding of sleep, of course, is like in a way, it's one of the main things that you can work on. Like if you just need to focus on one thing that's going to make your life better, am I right in thinking focus on sleep because then the other things will sort of fall into place?
Yes, yes. So most people think of diet, nutrition, exercise, and absolutely those things are important to health. But if you're not getting adequate sleep, you're actually shooting yourself in the foot, even when it comes to those things, because everything is better when you're sleeping better, including just like your metabolism, right? When you're not getting enough sleep, the hormone that causes you to be hungry or signals that you're hungry, ghrelin, is actually released in higher quantities. And the hormone that signals that you're full, leptin, is released in lower quantities. The prefrontal cortex, or the front part of your brain that is responsible for executive functioning, so rationalizing, making better, more informed decisions, does not operate as well when you're not getting sufficient sleep. And you really value instant gratification. So you're less likely to make good food choices. You're less likely to be active. You're just kind of normal. The calories that you burn from things like just fidgeting, moving around, walking, all of those things decrease. So you're much more likely to gain weight and suffer from obesity, regardless of whether or not you're working out. Other things like your insulin sensitivity decreases because when you're not getting enough sleep, you have this long-term increase in cortisol. Cortisol decreases insulin sensitivity. You're increasing your risk of type 2 diabetes. You're more likely to get sick, less likely to be able to fight infection. We're now learning that your risk of dementia, say it's like Alzheimer's, increases when you're not getting enough sleep. There are just so many things. Your mental health, the risk of mental health disorder significantly increases. People with insomnia, their risk of developing depression and anxiety increases by 10 and 17 times respectively. So everything is affected by your sleep. So if there is one thing to focus on in your life to live a happier, healthier, more productive life, it's getting good quality sleep.
No pressure.
None at all. Just a little bit.
Right. I know it's wild hearing. I know the studies and the research and the data really really emphasize everything that you're saying. It's just this cascade effect.
Yeah.
And I know I can't, so my mind goes when I hear that, it's like, yeah, okay, totally. But then how, and this is primarily what you do when you work with people, is help support them in their sleep. And so I'm going to assume when people hear this information, they're going to be, that's great, but now I have more anxiety around having to sleep. So what
Yeah.
do I
Yeah.
do? So that's, I have a feeling those listening are probably like, yeah, great. But now I'm thinking about that as I'm trying to fall asleep, and
Yeah.
that's not helping. What can I
Yeah.
do?
Yeah. And there's two different categories of people that I will often work with. I actually now do a lot of consulting with corporations because they're starting to understand how sleep affects their workforce and their productivity and their retention rates and all of those things and job satisfaction. So there are some people who they haven't quite come around to understanding just how important sleep is, right? We had that mantra, oh, sleep when I die, and, feeling like sleep makes them lazy, and feeling like it, you have to hustle and grind and sacrifice sleep. And so a large part of those people need that shock factor of like, actually, no, you're likely to reach an earlier grave, unfortunately, if you're not getting enough sleep. It actually increases your productivity and all those things. So sometimes people just need that kind of, wake up call to say, oh, actually, let me start prioritizing sleep. Then there are individuals who have chronic insomnia where they may understand the importance of sleep. They may have a desire to sleep. They may feel like they're trying and doing everything they need to, but they can't get sleep. And those are the individuals that, having those statistics in mind, while it's still important to know the effects of sleep, may, may be more harmful because a large part of chronic insomnia is sleep anxiety. So it's all of this anxiety you've built up around sleep. And sleep is a passive process that happens when brain waves slow down, when you're in a relaxed state. And so having anxiety, being worked up, being on high alert are all not conducive to getting good quality sleep. So with those individuals, we work on the cognitive aspects of their insomnia. So really reworking those negative thoughts surrounding sleep, helping them to unwrap how they kind of got to this place in the first place, and really undo those subsequent behaviors that they've fallen into in order to compensate for their lack of sleep. So it really is kind of a longer term process. And it's not that they shouldn't know these things, but now we have to work on not focusing on those, but focusing on what we can do to start getting you the sleep you need to not have to go through any of those consequences.
Yeah. And I think that's almost what's missed in a lot of the discourse around sleep conversations, or at least, going on social media, and it's like fear mongering, like sleep, you're going to, like, we're all going to die without it, and all these things which is true. But yeah, so I love that you really named that it's the cognitive and then doing things. So what I'm hearing when you're saying that is like, oh, we go through the side. We kind of come at sleep from the side angle in a way of like, okay, how am I breathing? So for me, and what we offer with Heart and Bones, of course, is movement and mindfulness and yoga. And so these things that aren't sleep direct, but they're sleep adjacent, and they help fulfill. So it's like it's not like you're looking at that goal of like, okay, must get to sleep. That's my destination, or else. It's like we're coming at it circuitously, just
Exactly.
around. Yeah.
Exactly.
So
Exactly.
yeah.
Exactly. And just teaching people to let go some of that pressure to fall asleep. The more pressure you have surrounding sleep, the more you try to sleep, the more effort that's involved, the less likely you are to fall asleep. And so it's teaching people to understand that it's not an all or nothing. Like, yes, it is important to know the health consequences of not getting sufficient sleep. However, as long as you're working towards healthy sleep, things will be okay, right? So it's not an all, you have to sleep 8 hours tonight or you're going to die. Let's let go of some of that pressure. In fact, a large part of cognitive behavioral therapy for insomnia is actually sleep restriction. So it's restricting the time, at least, that people spend in bed in order to improve their sleep quality, because quality when it comes to sleep is more important than quantity. And so one way I help people kind of relieve some of this anxiety is there's actually a big study that came out recently that basically compared quantity to quality of sleep, and basically said the regularity of your sleep is much more important when it comes to some of these long-term health consequences than just the quantity. So if you are getting, let's say, 6 hours of sleep, but it's on a regular basis, going to sleep, waking up at the same time, that is actually better than getting sometimes 8 hours, sometimes 6 hours, going to sleep 3 hours later, waking up. It's actually better to have that regularity. So for some people, they may feel like, God, I can't sleep for 8 hours. Like, it's so hard. Okay, let's start with being regular. Let's start with setting a schedule that you can stick to. And you're going to be reaping some positive benefits from that. And then we can start trying to increase the quantity.
Oh, that is super helpful. Yeah. And I think immediately listening to that is just like gives that sense of like, ah, okay, the pressure goes away a little bit and we can
Right.
all manage regularity than we can that if like, because when you said, yes, sleep is sort of like, you didn't say quite say passive, but just in my, that's how my brain went was like, so sleep
Yeah,
is this
passive.
passive thing.
Yeah, yeah.
We're not, you can't just like end sleep. So
Right.
yeah, so being
Yes.
able to, well, I can't control that switch, so to speak, but I can control, okay, I can go to bed at this time. I'm going to do my best. So what if somebody who's now hears this and goes, okay, great. That's what I want to focus on is that regularity of my sleep. But then they go into bed at that regular time and then they're lying in bed and their thoughts are going and they're like, but I'm supposed. So what would that person do in that moment?
Yeah,
So how
yeah.
do you,
So the first thing I recommend is when we're trying to fix anyone's sleep, right? And especially working on regularity, it's actually much more important to wake up at the same time every night than it is to go to bed at the same time every night.
okay.
You want to keep the schedule consistent both ways, but if you had to choose one, it's waking up. And much of us have much more control over the time we wake up than the time we fall asleep. Because like you said, you may get into bed and you're not sleepy and you're like lying in bed. And then again, you're trying to force it. But typically, it's easy to set an alarm clock to wake up at the exact same time. So start there. That actually helps to reinforce your circadian rhythm and makes it more likely that you'll fall asleep at the time that you desire as well. But let's say you're like, okay, it is important to wind down at the same time and attempt that. But one of the keys, especially if you have insomnia, is only go to bed when you're sleepy. So if you're winding down and you get to the end of your routine, which I suggest a good bedtime routine to be somewhere between 45 minutes to an hour, if you can do that, and you've reached the end and you're not sleepy enough to fall asleep, extend it. Do some other relaxing activity until you are, because there's no reason to try to force sleep. As we already said, sleep is a passive process. The more you force it, the less likely it is to happen. So if you're getting into bed and you're like, this isn't working, and you find yourself getting anxious, like, okay, no need to force it. Actually get out of your bed, do some relaxing activity, deep breathing exercises. Yoga is great, meditation. Just take your mind off of trying to fall asleep. And then once you feel sleepy enough to actually fall asleep, get back into bed. And the more you do that, the more you're actually likely to make your bed such a strong stimulus for sleep that you're likely to fall asleep when you're intending to, but it just may take some time to get to that point.
Brilliant. I love that so much. And again, that sense of way less pressure. And it's just this reset. And so in a way that what I'm hearing you is that the focus then becomes on restfulness and
Yes,
signaling to your nervous system and signaling to your body and creating a new pattern. And this may not happen in the one night itself, but over
exactly.
time, if you have that regularity of like not falling asleep, okay, I get up, I do gentle movement, I do gentle breathing, and
Yes.
then over time it sort of compounds on itself so that am I back me up here or not, but I'm
Yes.
assuming
No,
that, yeah,
you're
your nervous system's
100%
like,
right.
oh, now this is rest time. And even
Yeah.
if the quality of that actual sleep isn't, whatever, quote, quote, perfect, yeah, we're getting up at the same time at the
Yeah.
very least, and then signaling and just creating this pattern and this new habit.
Yes.
Hour, 45 minutes before bed. Okay, this is
Exactly,
helpful.
exactly.
These are
Yeah,
really
because
great.
at the end of the day, what you're trying to do is train your brain to understand that bedtime sleep, your bed is a time for relaxation as opposed to anxiety. Some people have so much bedtime anxiety that they've actually trained their brains that when they get into bed, heart rate increases, blood pressure increases, respiratory rate increases, even if they didn't have an awareness of being anxious before, because they've spent so much time connecting their bed with anxiety. So your brain works in a way that makes connections between commonly associated experiences and feelings in order to make life more efficient for you. So if every night you're laying in bed for 2 hours tossing and turning, feeling anxious and frustrated, your brain is like, oh, this is where we do this. Let's just cut to the chase and be anxious. This is where we get anxious. And you want to disconnect that. You want to have your bed be your safe place. I say one of the most important relationships you will have in your life is the one between your bed and sleep. So you want to help break the relationship between your bed and being anxious, and that's the way you do that. So let go of that pressure. If you're not falling asleep, it's okay. Do something relaxing until you are sleepy enough to fall asleep, and then you help to slowly rebuild that relationship.
Oh, so good. So good. And I wish that easefulness of that kind of pattern and practice was more common. Because again, it's like coming at it from around, that again, that
Exactly.
circuitous way of approaching sleep, not as that direct destination once more, but this like, here's this beautiful little detour, sleep detours we can take towards then, oh, wait, I did sleep. Oh, wait, I did
Exactly.
actually fall asleep a little bit earlier.
Exactly.
And
Exactly.
yeah, I think, yeah, it's so important for people to hear. And then in your practice, when you work with people, do you find that the success rates of that when we approach it from that more holistic, well-rounded, indirect way of focusing and reframing our relationship to sleep, how effective has it been? Like, what are some fun success stories that you've had with folks?
Yeah, it's is significantly successful. So cognitive behavioral therapy for insomnia, which involves a lot of the principles I talked about, is the number one treatment for insomnia. Over prescription sleep medications. I know everyone wants a quick fix. Give me this drug, help me fall asleep, but it doesn't have long lasting effects. You tend to build up tolerance. There are lots of side effects. So because of that, cognitive behavioral therapy for insomnia is the number one treatment. I recently had a client who had struggled with insomnia for 11 years. And when we started working together, she was like, I'm just going to tell you, I can't sleep. Like, I just, I'm in this program because I want to sleep. But also I just am not convinced that I can, which was, again, no pressure to help her. But we had to really untangle and unfold some deep rooted beliefs surrounding sleep and anxieties that she didn't even realize that she had. And after working together, so before we started, she was waking up multiple times throughout the night, unable to fall asleep. Again, had this dread surrounding sleep and this battle. And of course, she didn't go to, sleeping 8 hours a night consistently, but sleeping significantly more than she was before. Her middle of the night wakings almost completely vanished. She now had a healthier relationship with sleep. And she just like, when we finished, she cried actually, because she was like, actually didn't believe that this could be possible. Again, I thought that this was just my life, that I just wasn't incapable of sleeping. And so many people that I work with have that sense of like, I guess I just can't do this. And it's like, no, that's not true. But there are just so many things that we have to unpack that you've built up over years, 11 years of habits that you've fallen into because you've convinced yourself that you can't sleep. So it's possible. It works. It has long lasting effects as long as you're willing to put the work in.
Oh, those are such great examples. That's really helpful for people to hear. So, Angela, now let us know all about your sleep programs and your book and how people can reach you, because this was such a succinct, focused overview. I think that will really ease a lot of people's sleep anxiety. I think that's what I'm hearing from you is like a really one of the biggest things, really, hey, about sleep is that how do I not feel anxious? Yeah, we all know we need sleep. Wait, I have a small child, I'm not sleeping. I'm a caregiver, I'm not sleeping. I'm a shift worker, I'm not sleeping. So, all of this, I think, is going to give a lot of empowered positivity to those listening who maybe don't have the ideal sleeping conditions. So, thank you so much for this, and tell us more about how people can continue to work with you and what you share and you offer.
Yeah, absolutely. I think one take home message that I like for people to understand is that there's always something you can do. You may not be in the most ideal position in terms of your sleep, but there are small changes you can make to reap the healthy benefits of sleep. So don't feel like you need to be anxious or that there's nothing you can do, because there's always something you can do. Part of that is what I share in my book. It's called Sleeping on the Job. And I really break this down as it relates to work and sleep, because I think how and where you work has a significant impact on how you sleep and vice versa. And so those two worlds are so interconnected that I felt that I needed to approach it from that lens. And you mentioned shift workers. I actually break it down based on the job type. So remote workers, shift workers, overnight workers, to help them understand that there are some nuances to sleep, but there are things that they can do to get the sleep that they deserve as well. I do have sleep programs that you can find on my website, thesolutionissleep.com, along with information about my book. And in that, I mostly do cognitive behavioral therapy for insomnia. So for individuals who have been struggling for a long time, you can feel free to look into my programs. And I'm just here to help as many people as I can get the sleep they deserve to live the life they desire.
Thank you so much.